So being a parent is hard work. I've done it. I've got 2 kids. Actually, 1 kid and 1 teenager. And being a parent of a child in pain can be even more work and a very scary thing. But before you go and run out and get that prescription filled, there are some things to consider. A large study shows antacid and antibiotic use in early childhood significantly raises the risk of developing allergies. Researchers looked at the records of almost 800,000 children born during a 13-year period to families in the military. Surprisingly, almost 10% of the babies were treated with antacids, such as Zantac or Pepcid, for acid reflux. Spitting up is common in infants and does not typically need to be medicated, but it can be scary when you're not aware. After all, adults don't spit up, so why should babies, right? No. Also surprising was that more than half of the children in this study went on to develop allergies, rashes, asthma, and/or hay fever. However, the children who received antacids in infancy were twice as likely to develop allergic diseases compared to the rest. What's worse is their risk of developing anaphylaxis, a severe allergic reaction that can be deadly, was 50% higher compared to the non-medicated children. Children who received antibiotics as babies were twice as likely to have asthma and had a 50% higher likelihood of hay fever and anaphylactic allergies. So those are some pretty significant increases in incident rates and pretty good reasons to rethink those medications. So the researchers suggested the negative impact antacids and antibiotics have on gut bacteria, also called the gut microbiome, plays a significant role in the development of allergies and other autoimmune or immune disorders. Additionally, by neutralizing the acidity of the stomach, which is necessary to break down foods, antacids may also be allowing undigested foods into the small intestine. This negatively impacts the gut microbiome and inflames the digestive tract, ultimately leading to a leaky gut type condition, which if it's like leaky gut, it's going to become leaky gut. Ever heard the term fake it till you make it? So the health of the digestive tract and the gut microbiome profoundly influences immune health. When the gut is inflamed and damaged and gut bacteria is unhealthy and full of all the different kinds of bad bacteria, this predisposes a person to a bunch of immune-based disorders, including, but not limited to, allergies, food sensitivities, chemical sensitivities, eczema and other skin-based disorders, asthma and other respiratory disorders, autoimmune disorders, brain-based disorders, and others. Kind of sounds like a drug commercial, right? Although spitting up is normal for babies, if a baby is spitting up excessively, you have to ask why. Also, if a child has recurring infections that require antibiotics over and over and over again, you have to ask why. With any other health issue or condition, asking why is one of the most important questions you can ask, and one of the things we try to answer in my practice. And it's something that you should always be asking, why? Why do I have this? Why is this happening? Why do I need to take this? Why? These are the signs that the health of the digestive tract and the gut microbiome and the immune system are already in distress. For instance, the child could be eating a food to which they are intolerant, not allergic, intolerant, such as gluten and or dairy, 2 primary triggers of immune disorders. The child may have been born with food intolerances or autoimmunity when the immune system attacks the body, passed on from the mother. A child born via C-section and fed formula is likely to have less healthy gut microbiome than a child born vaginally and breastfed. This may predispose a child to excess acid reflux or recurring infections. Look up vaginal swab or sweeping for those moms that need to do C-sections. It may significantly help the health of your baby, and it's very interesting that a lot of doctors are doing this. A lot of cool research on it. However, medicating a child with antacids and antibiotics only further destroys the gut microbiome and dysregulates the immune system. This makes the child significantly more prone to immune disorders such as allergies, anaphylaxis, autoimmunity, asthma, eczema, obesity, and other chronic issues. The key is to address the underlying causes of an inflamed gut, an unhealthy microbiome, and inflammation. Some things you should look at are regular blood testing for nutrient deficiencies and excesses, stool analysis, allergy and food sensitivity, just to name a few. Thanks for watching. Make a comment, subscribe to my YouTube channel, button right there. I'm Dr. Craig Mortensen. Be healthy, be happy. See you next time.